Hello everyone, welcome to my YouTube channel. So today we are going to learn about tachyphylaxis, which is an rapid decrease in drug response, or you can call it as an acute tolerance. So you must learn the difference between the tolerance and tachyphylaxis. So first you're gonna learn about the tolerance, then you're gonna understand about the tachyphylaxis because it is totally related. So what is tolerance? So an acquired resistance to the drug. So if you are taking tablets from 2 years, so it is the prolonged. So from 2 years you are taking the same drug daily. So an acquired resistance to the drug. So there is a prolonged administration and you developed some resistance to the drug. So what is resistance? It is nothing but you are taking the same amount of drug, but to the amount of drug your body was not responding. So if you are daily taking 25 grams of the drug for 2 years, the body got responded, but for the same amount the body was not responding to the drugs and it requires more amount of drug. So if you given 50 grams, it's gonna respond. So it is a prolonged administration and an acquired resistance to the prolonged drug. So prolongedly taken drug. So an acquired resistance to a drug after prolonged administration. So this is called as tolerance. So when requirement of high doses of drug to produce the response. So for 50 grams you're gonna respond to the drug, but to the same amount which you are taking for 2 years, you're not going to respond. Your body is not gonna respond. So it is called tolerance. A normal dose does not show its effects when tolerance is developed, and it's gonna show when there is high doses of the same drug. So it is tolerance. So then we come to tachyphylaxis, which is an acute tolerance. So what is tachyphylaxis? It is the rapid development of tolerance from 2 months, or you can say it is very rapid. You can say 2 days or 1 day, 2 days. If for few doses of the drug you are taking and there is rapid decrease in drug response, so it can be called as an acute form of acquired tolerance, and the tolerance was acquired and in a very short period of time. It is tachyphylaxis. So you can make a sentence like this: it is the rapid development of tolerance when drug administered repeatedly at short intervals. So it is called tachyphylaxis. So the rapid development of tolerance when a drug is administered in a short interval is called as tachyphylaxis. So these tolerance, this acute, you can say acute tolerance. So tachyphylaxis is also called as acute tolerance. So these acute tolerance is developed very rapidly. Okay, so this is called tachyphylaxis. So for example, ephedrine and tyramine and amphetamine. So these are the examples of tachyphylaxis. So what is the mechanism of action of tachyphylaxis? So this is the nerve ending and it has 6 noradrenaline sites and also called norepinephrine, and from these pump, this is the blood vessel. The blood vessel have alpha receptors. So when these noradrenaline get attached to these alpha receptors, it undergoes vasoconstriction, which increases the blood pressure and it treats hypotension. So it increasing the blood pressure and it treats the hypotension. So the blood pressure was increasing and the hypotension was getting treated. So to make this happen, the drug called tyramine was given. So it is indirectly acting drug. So what it will do? So the tyramine brings and attaches the noradrenaline to the alpha receptors and increases the blood pressure, and then it increases blood pressure and it treats hypotension. So this tyramine is helping in bringing noradrenaline to alpha receptors, and these get attached and it undergoes vasoconstriction, right? So how this tachyphylaxis was developing? You can say it as acute tolerance commonly. So for example, if there is 6 epinephrine sites here, so this drug called tyramine comes in. So for example, I am drawing here. So we have 6 norepinephrine or noradrenaline, and we have this blood vessel, and we have these alpha receptors. This tyramine was coming here. So we have 6 norepinephrine and 2 drug molecules of tyramine were coming. So these 2 tyramine were taking 2 epinephrine to the alpha receptor, and it undergoes vasoconstriction, and it undergoes hypotension, and it gets treated. And again we are giving second dose to the patient, and 2 tyramine were taking 2 noradrenaline. It displaces actually and got this effect. So again the third time, so it has given 2 tyramine, again 2 tyramine dose was given, and it displaces 2 noradrenaline. But what happens? So 3 times was completed. So fourth time we are giving this drug called tyramine, but to displace the tyramine with norepinephrine, there is no norepinephrine here in the neuron. So there is no norepinephrine, so it not gonna treat it. So hypotension was not gonna be treated. So tachyphylaxis, in intolerance, increase in drug amount can give results, but in tachyphylaxis it does not depend on the drug amount, so it does not gonna treat it. So increase in drug amount will not treat tachyphylaxis, and it has no relation. So this is the mechanism, MOA of tachyphylaxis. So if you like this video and you deeply understand the difference between the tolerance and acute tolerance, that is tachyphylaxis, please like, share and subscribe to this channel, and it gonna help me a lot, and it means to me a lot. So please do it.